Over the last 24 hours, we identified 487 new cases of COVID-19 and completed about 10,300 tests. Our positivity rate was about 4.8%. Cases in school-aged children continue to decline. There are currently active alerts or outbreaks in 184 schools. Of these, 4 schools had 10 or more COVID cases who attended during the last 14 days while infectious. As the Premier mentioned, there are currently 697 people being treated for COVID-19 in hospital, including 155 in the ICU. Sadly, I must announce that 14 new deaths were reported to Alberta Health in the last 24 hours.
I'm pleased to announce that starting Monday, even more Albertans will be eligible to book a booster shot at least 6 months after they receive their second dose. Based on the latest evidence from both the National Advisory Committee on Immunization and the Alberta Advisory Committee, booster doses will be available to all Albertans aged 70 and older, as well as all First Nations, Inuit, and Métis people aged 18 and older who are both on and off reserve or on and off settlement when they are 6 months or more from their second dose. So just to make that simple, anybody who is 70 years of age or older in the general population can now book a booster shot, a third shot, as long as 6 months have passed since they got their last shot. And some may ask, why are we making this more generally available to the First Nations, Indigenous communities at 18 and above? Well, the data sadly shows that Indigenous people have suffered significantly worse outcomes from COVID-19 than the general Alberta population. And this is a reflection of that higher level of risk. We want to provide that protection to anybody who might have an elevated risk level. We are also offering additional protection for healthcare workers, providing direct patient care who received their second dose less than 8 weeks after their first dose, because the data shows that the closer the interval, perhaps the less durable the protection of those vaccines. And anyone who has received only viral vector vaccines, for example, 2 doses of AstraZeneca vaccine, will now also be eligible for additional doses.
Throughout the month of October, we have seen a sharp decline in our cases across the province and across Albertans of all ages. We have passed the peak of the 4th wave thanks to the targeted public health measures we have in place and our rising immunization rates as more eligible Albertans choose to be immunized. This combination is helping to reduce the demand for acute and critical care for those with COVID-19, making third doses available as of next Monday to an additional 600,000 eligible Albertans 6 months after their second should also help make a difference. As Chief Medical Officer of Health, I fully support the expanded eligibility for booster doses, as the evidence has shown protection against severe outcomes may decline faster in these groups. I know that many Albertans may be wondering when their turn will come and whether they should also be getting booster shots. I'd like to be clear that at this time, the evidence does not support a need for boosters in the general population, where most people receive their second doses at a longer and more effective interval from the first. We will continue to monitor all emerging evidence on vaccine effectiveness across Canada and around the world, and will bring forward recommendations on additional boosters for the public if needed.
We have a lot of work still to do, but there is light at the end of the tunnel. AHS is restoring surgery volumes as fast as they can as the pressures on ICUs decreases. Volumes are now at approximately 2/3 of normal surgery levels and climbing, and I expect the situation will continue to improve. But there are still hundreds of Albertans every week not able to receive surgery that they need, and I extend my deepest sympathy to those patients and their families, and I want them to know that I'm supporting AHS in ramping back up surgeries as fast as possible. And as capacity recovers, AHS is giving priority to Albertans who are the sickest, including cancer patients. And I'm very grateful to hear that cancer surgeries have fully resumed. No more cancer surgeries are being postponed due to the COVID-related capacity constraint. And I'm working with AHS to develop a plan to get us back to 100% of normal surgery volumes as soon as possible, and then beyond the 100% to start working down the backlog.